Good morning. At the outset, let me thank dear Dr. Banshi Sabu sir and the entire team of RSS Day 2021 for this opportunity, and I would like to congratulate the entire team for the huge success of this conference. So, in the next couple of minutes, I'll be discussing on the digital diabetes clinic in the present scenario. Diabetes being a global public health crisis, the present estimated number of people living with diabetes worldwide is more than 400 million. And definitely, the projected number of patients who will be having diabetes in the coming decades is more and more. So, whenever, while you are treating your diabetes patients, we have to aim for better control and target levels in our patients so that we can avoid the higher risk of getting microvascular as well as macrovascular complications, which includes cardiovascular uh, events, blindness, more number of amputations, and of course, chronic kidney disease, which can happen in your diabetes patients if blood sugar control is not being achieved properly. So, diabetes presents many challenges, and definitely it requires healthcare system to adapt and remodel so that to address growing threats to personal, social, and economic well-being. So, the virtual care can provide much needed support for people who are living with diabetes, who are getting treated for their diabetes. And these patients who often need frequent visits to their doctors in a year, with the usage of this virtual platform or the digital diabetes care, can definitely reduce the numbers of emergency room visits. And of course, it also means you would not necessarily need to leave your home or place to get health care. Digital technology, digital health technology, especially digital apps and the health applications, have been developing rapidly to help people manage their diabetes. Numerous health related apps provided on smartphones and other wireless devices are available to support people with diabetes who need to adopt either lifestyle intervention or medication adjustments in response to their blood glucose level being monitored. So, what had happened recently? Why we are discussing more about this virtual platform or the digital care being provided used in diabetes management? The recent COVID pandemic had caused massive disruption in the entire world due to this COVID pandemic, which had brought a significant impact among the non-communicable disease, mainly our diabetes patients, had to suffer. And one of the sustainable development goals targeted by the WHO is the reduction of premature death before the age of 70. But what we have seen recently during this pandemic situation was we lost our dear ones. Those who had diabetes or lifestyle disease, and those who didn't have this any of these lifestyle diseases because of this COVID 19. However, during the period of the initial months or the beginning of COVID-19 pandemic, we saw many countries, more than 40 more countries that have switched their diabetes care services into the virtual model because diabetes being at high risk during this pandemic situation to be affected. Going for virtual or the digital diabetes care provided, somehow we could manage at least some patients to have a better control with their diabetes management. So, what is the significance of the digital diabetes clinic? Those patients with diabetes is actually generating substantial amounts of clinically significant data on a daily basis. their self-monitoring blood glucose levels, along with automated or patient-reported recordings of food intake, their dietary pattern, physical activity, medication, the dosage of medicines being used, and the insulin injection, timing, and the doses, which can form an entire metabolic kaleidoscope. So this data actually or often go unobserved. And the prevailing challenge is the collection of this data and the usage of this data to improve patient care as well as to achieve better glycemic control among your patients. Uh, Timely intervention is the key. So we are all struggling to control our patients' blood glucose levels as low as safer one to be attained, which reduces the future micro or macrovascular complications among our patients, which can be only achieved by regular monitoring of blood glucose levels, that is individually dictated with individually dictated intervals and by proper adjusting of diet, medication, including insulin doses according to the blood sugar levels got in your patient. So SMBG is frequently performed by the patient, but often there is no resultant action. They will be reporting, they will be recording these blood sugar levels in their diaries, scribbling in their diaries, or the newer platforms available. But timely intervention or the decisions won't be made properly. So patients may be unsure or don't know how to modify their dietary or medical regimen in light of the glucose measurements. Moreover, physicians and other team members involved in the diabetes care may neglect to review these data being taken by the patients during their infrequent visits to the diabetes clinic. And additionally, several weeks following an episode of significant high or low sugar, both hyper as well as hypoglycemic episode, the patient may not remember what led to the abnormal blood glucose measurement. What was the reason for that particular high or low sugar episodes? Any change in diet, physical activity, or missing any dosage or over dosage of medications. So these instances will be actually forgotten by the patient and not discussed with the healthcare team means to prevent subsequent events from occurring is not happening. So how can it be made possible? The usage of the serial monitoring of blood glucose data done by the patient is very important. So SMBG data and a point of care glucose monitoring device combined with mobile technology can enable real-time transmission of glucose values to a centralized system. Supplementing this system with automated alerts that can be transmitted to the diabetes team or healthcare providers, patients or significant others can enable mindful and timely use of these huge data which is being generated. And furthermore, the centrally available data may be used to monitor a single clinic or a large population to an extent, which can follow the patient trend, individual trends, recognize the regional patterns. This may enable reaching out in time to your patients who are in need while reducing the frequency of visits of patients who are having a well-controlled blood glucose levels and thus enabling judicious allocation of limited time resources. So how can it be made possible? Definitely with the usage of the diabetes technology, like in the symposium, the other speakers will be discussing in detail about the topics which I will be going through. And despite the increase in the number of effective drugs, the availability of advancement in treatment technologies and evidence-based prevention and lifestyle modification programs, why then does diabetes treatment outcomes are not improving? That's why And that's where you have to discuss about the usage of newer technologies uh, maximally among your patients, including telemedicines and the different applications or the virtual platform available. So the diabetes technology, the numerous diabetes technologies that are currently available can empower diabetes care providers as well as the patients or the caregivers, and thereby make disease management much more effective and hassle-free. Major examples include the minimally invasive, user-friendly glucose monitoring system with better accuracy, and in cases like type 1 diabetes or brittle diabetes, whenever it is indicated, the option of using continuous subcutaneous insulin infusion, providing near physiological insulin delivery, and the point of care testing devices that provide immediate and actionable information, and the various artificial intelligence enabled mobile apps for diabetes management. So these technologies have to be making use in a proper way to have a better control in your diabetes patients. And you have uh, for so many years, we are having these smart glucose meters with apps connect to capture the glucose readings via Bluetooth, which can be conveniently assessed on a smartphone, tablet, or computer. The captured readings will be automatically synced and logged, and over time helps create meaningful insights regarding how one's lifestyle can affect the blood glucose levels. Thereby, proper decision can be taken on the right time. And you have so many other options available now, including the flash glucose monitoring, which is available in two forms, about Freestyle Libre and the Freestyle Libre Pro. The sensor comes in a factory calibrated mode, thus eliminating the need for frequent finger pricking for calibration. So the usual recommended sensor wear time is 14 days, and the system actually captures a huge data. The data is robust, and with the usage of this huge data, you can help your patients, and the patient themselves can have an idea on how the blood sugar trend is, what is happening, what's the impact of their particular diet pattern, or the stress, or the medication, the treatment regimen, or their physical activity, how it impacts on their blood glucose levels. These things can be known by the team and the patient as well, so that the proper timely interventions can be made. And of course, we are having the newer technology. The technology is so advanced and it helps a lot. Recently, during the COVID pandemic crisis situation, during the lockdown situation, when patients couldn't attend the clinics for their proper treatment, many lives were saved with the usage of these technologies. That is sure. From our center also, we have shared our experience with the usage of Apple Watch ECG, where the patient had symptoms at home, and with the help of this Apple Watch ECG, the timely treatment decision were able to be made, and the life was saved of that patient who had a cardiac event at home, but managed on the right time with the usage of the newer gadgets available. That is, I'm discussing about the Apple Watch ECG. So what is the advantage of the virtual platform or the newer digital diabetes clinics we are discussing? The ease of access to remote areas. The usage of this digital diabetes clinics in peripheral health setups can significantly reduce the time and cost of patient transportation. Monitoring, home care, and ambulatory monitoring is possible. It improves communication between the healthcare providers separated by distance. Critical care monitoring, where it is not possible to transfer the patient, it will be a huge help. And of course, the continuing medical education and the clinical research area will be getting benefited with the usage of this digital diabetes clinic, being a tool for public awareness, a tool for disaster management. We can get uh, expert opinion regarding the treatment and bring the experts in the team for getting a better opinion with regard to the treatment modification. So at this point of time, I would like to share our own experience. The diabetes telemanagement system, which we practice at our center, is a telemedicine based follow-up program originally introduced at Jodesh Diabetes Research Center at Trivandrum way back in 1998. Actually, it is a chronic disease management system which enables patient to interact lively with a professionally trained multidisciplinary team. The team comprising of diabetes educators, nurses, dietitians, pharmacists, psychologists, physicians, all the team members who are involved in modifying the dosage of medications, diet, physical activity, either through telephone, email, or through secure website. So this is how the unique designed software, that is a diabetes telemanagement system, is functioning. The trained multidisciplinary team, who is the team involved in this diabetes telemanagement system, tries to overcome the globally recognized major barriers during the management of diabetes, namely the fear of hypoglycemia, polypharmacy, discontinuation of statins, maybe by the patients or on advice of some of the relatives or others, non-medicals, and avoiding antihypertensives, wrong injection techniques, monitoring not being properly done. So the diabetes telemanagement system is designed to provide individualized therapy advices on getting target glycosylated hemoglobin, blood pressure, and lowering the lipids, that is customized to multiple patient characteristics, which help to attain goals of therapy without any risk involved. And the system has been tested on various platforms over a decade and was shown to be a patient-friendly approach with successful outcomes due to a live, round-the-clock interactive communication in contrast to text or recorded messages. So this is the DTMS, Diabetes Telemanagement System, which we use at our centers. So during this pandemic situation, we also had something along with our diabetes telemanagement system for our own patients who had COVID-19 infection. That was the virtual COVID IP care, the VCIP. That was a valuable model for others providers to deliver inpatient level care in the patient's home virtually, both during the COVID-19 pandemic and of course in future epidemics of highly transmissible disease. It will be a helpful option. So the entire team was available round the clock with proper monitoring of the vitals of patient, which included temperature checking, saturation, blood pressure monitoring, blood glucose monitoring, and at home blood sample collection for essential lab investigations, which included the different lab evaluation. And of course, the earlier part when I discussed about the blood glucose monitoring, the flash glucose monitoring or the remote monitoring of continuous glucose monitoring was possible during this COVID situation, pandemic situation, where we had lockdown and patients couldn't access the healthcare providers or the hospitals who are under quarantine or at home quarantine or getting treated for COVID at home. So the Libre, the Guardian Connect, connected glucose meters, Apple Watch, all those technologies, etc., which were used in selected patients was actually helpful in treating or controlling things during this bad pandemic of COVID-19. So definitely we have to thank the technology. So whenever we discuss about the technologies, of course, we have to take care of the limitations. So what are the limitations? Definitely the different apps being advocated or used in the diabetes platform, whenever we use, you have to consider this limitation with the usage of these technologies, the technological issues which we commonly uh, come across while using these health apps. This includes the maintenance of mobile apps so that they are up to date with the latest technological platform and the operating systems and free of bugs and that degrade app performances. And definitely, the consumers who are use a variety of mobile technological platform, including Android or Apple iOS. So definitely standardization is the other main thing or the main limitation to be discussed. And difference among the population you are treating, the two population mainly while we discuss among the population, the older and the younger one. The older, let it be the type 1 or the type 2, because we are having recommendations like monitoring of blood glucose to be done at the age of 25, because we are seeing more number of type 2 among that age group. So the younger age group are typically more proficient at using the smartphones than the older population. But during this COVID pandemic, many a time we saw the older generation also mastering on this technology during the time of COVID-19 lockdown and other, uh, what to say, the crisis situation the whole world went through. And of course, while we discuss about the data, the security and privacy definitely is a key aspect in this digital world, especially for medical data. So that is also very important to be taken care of. So what is the future areas of research with regard to this digital clinics? Studies should be conducted to determine the optimal doctor-patient and nurse-patient ratios for such a program so that providers do not become overwhelmed. The team is involved in this care, so you have to take care of this matter. The training regimen for healthcare providers, that the newer thing which we are discussing is very important. You have to train the team involved in this care, must be optimized for a larger number of healthcare providers on use of technology and appropriate code of conduct in these unusual circumstances. Of course, evaluation is very important. To evaluate the efficacy of this monitoring program in identifying patients at risk of progressing to severe disease. So the smart hospitals or the digital clinics which we are discussing, technological enablement, digitization, and automation are affecting industries today in profound ways. Smart infrastructure makes extensive use of emerging technologies like artificial intelligence, Internet of Things, in order to create more integrated, efficient space that best suit the needs of their users and occupants. Smart hospitals are not only being used to improve care delivery within the building, but they are aiming to connect to and contribute towards the broader healthcare delivery ecosystem. So the newer technologies are being integrated in hospitals and healthcare delivery system, which includes artificial intelligence, robotics, precision medicine, 3D printing, augmented and virtual reality being used, genomics, and of course, the telemedicine, which we are also practicing at our center. And we are moving at our center, we are moving on to the fully digital diabetes screening soon. So by using powerful new technologies like digital twins, data analytics, hospital administrators can better understand the need of both patients and staff in order to create a more seamless experience and higher standards of care. So with this, I would like to conclude my presentation. Once again, thank you. Thanks a lot for this opportunity. Thanks to the entire team of RSSDA 2021.